Rachel, and this is Michael. I'm going to be doing a neuro assessment, an abdominal assessment, and an arterial and venous assessment. How are you doing today, Michael?
Doing good.
Great. I'm going to be doing all those assessments. Is that okay with you?
Yep.
Great. So first I'll start with your neuro test. I'm going to first, during this exam, I'm also noting the patient's mental status and the patient's speech. Can you please state your first and your last name and your date of birth for me?
Michael AXILLA, February 14th, 1992.
Perfect. And do you know what day of the week it is?
Wednesday.
Okay, and where are you right now?
Milpitas.
Perfect. So patient is oriented to person, place, and time, which is great. I'm also going to do the 3 words. So I'm going to tell you 3 words right now. I want you to repeat it after I say it, and I want you to repeat it to me after this interview. Okay? So the 3 words are going to be vase, couch, and table. Okay, can you repeat that for me?
Vase, couch, and table.
Perfect. Okay, so we're going to start with the cranial nerves. So the first cranial nerve is the olfactory nerve, which is for the patient's sense of smell. I'm just using a cotton pad. Oh, let me actually put on some gloves for that. So we're going to test the cranial nerves, put on some gloves. I washed my hands already. Okay, so Michael, if you can close your eyes for me. Okay. Can you smell that?
Yep, I can smell that.
Okay, both nostrils?
Yeah, both nostrils.
Okay, great. So smell is intact. Second cranial nerve is going to be for the optic nerve. At this point, the Snellen chart is already done, so right now I'm just going to check the patient's visual fields. So I want you to cover this eye for me. I'm going to cover my opposite eye. And I'm just going to wiggle my fingers from the back of your head to the front. Once you see my fingers wiggling, just say yes. Okay?
Yes. Yes. Yes.
Perfect.
Yes. Yes. Yes.
Okay, let's cover your opposite eye for me. Okay.
Yes. 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 Yes.
Okay, very good. So now we're going to move on to cranial nerve number 3, which is for the patient's pupillary response. I'm going to be shining a bright light in your eye and just look forward for me, okay? All right. Okay, very good. Very good. And now I'm going to be doing the consensual response. Okay. Okay, and that's intact. Very good. Now I'm going to be testing the patient's cardinal gazes of vision. So without moving your head, just your eyeballs, I want you to follow my finger, okay? Okay, very good. So that is intact. Now we're going to be testing the patient's trigeminal nerve. There's 3 branches of the trigeminal nerve, and I'm going to be testing Michael's with this Q-tip. So Michael, if you look at this Q-tip, there's a sharp end and a dull end. I'm going to be putting one side of the Q-tip on your face. Whenever you feel the Q-tip on your face, just say yes, and whether or not sharp or dull. Okay? Close your eyes for me, please.
Sharp.
Okay.
Sharp.
Okay, same on both sides?
Same on both sides.
Okay.
Sharp.
Great.
Sharp.
Okay, same on both sides?
Same on both sides.
Okay.
Dull. Dull.
Okay, same on both sides?
Same on both sides.
Perfect. So the trigeminal nerve is good. Now we're going to move on to the facial nerve. This is for the patient's facial expressions. So I'm just going to have you big smile for me. Thank you. If you could furrow your brows and look mad. Perfect. And now I want you to lift your eyebrows and don't let me push down. Okay, strong. Close your eyes really tight and don't let me open them. Okay, and then puff out your cheeks for me, and don't let me push down. Very good. So facial expression and everything looks good. Okay. Now I'm going to be doing the hearing test. This is cranial nerve number 8. I would be doing the Weaver and the Rini test, but right now I'm just doing the whisper test. So if you could cover this ear for me, I'm going to whisper a word and just repeat it to me, okay?
Sunday.
Great. Let's cover your other ear. And again.
Sunday.
Perfect. Okay. Now for cranial nerves 9 and 10, I'm going to have the patient drink some water to test the patient's swallowing. Okay, swallow. Any problems with that?
No problem with swallowing.
Perfect. And then I just want you to open your mouth and say ah. Perfect. So the uvula moved up, uvula's midline, soft palate went up. Now I'm going to be testing for the neck and shoulder movements. If you could shrug for me. Okay, very good. I'm going to have you look this way and push my hand with your cheek. Very good. And let's look the other way. Push your hand with my cheek, or push your, okay. Very good. So that is good. Lastly, I'm just going to have the patient stick out his tongue all the way out. Tongue is symmetrical, and that's the last cranial nerve. Okay. Now we're going to move on to the sensory portion of the neuro exam. So we're going to use the Q-tip again. So Michael, same thing. I'm going to be stroking the Q-tip on your arms and on your legs. Just let me know if it's sharp or dull.
All right.
Okay? If you can close your eyes for me. We're going to move your hands just like this.
Sharp. Sharp.
Okay.
Dull. 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 Dull.
Mm-hmm.
Sharp.
Yep.
And sharp.
Very good. Okay. So sensory is good. The second part of the sensory would be the vibration test. I don't have the tuning fork, but if I did that test, I would hit it and place the vibrating tuning fork on the patient's thumb, and then also the big toe, and make sure the patient can feel it. For the proprioception portion of the sensory test, I'm going to have you put your hands out like this. I want you to close your eyes. I'm going to draw a number on your hand and let me know what number I'm drawing, okay?
3.
Okay,
3.
perfect. So now we're going to move on to the cerebellum testing. So this one, we're going to start off with the finger to nose test. So I want you to put your finger on your nose, on top of your nose. Very good. I'm just going to, whenever I move my finger, touch your finger to my finger and back on your nose. Okay? Okay, my finger, back to nose, back to nose, back to nose, oh, back to nose, back to nose. One more time. Very good. Now I'm going to have you stroke your shin to your, your heel to your shin. Perfect. And let's do both sides. Very good. And I'm just going to have you do this for me. Rapid hand movement. Very good. So cerebellum test is good. Now we're going to go to motor and strength training. So for this test, I'm just feeling for the patient's muscle bulk. Sorry about this. Let me know if you feel any tenderness, anything.
No.
Okay, I'm just noting the muscle bulk. Well flexed, normal, no atrophy that I'm noting. Looks good. Okay, now for the strength training, I'm going to start with the shoulders. Shrug your shoulders for me. Very good. I'm going to have you hold your hands like this. This is for the elbows. Push up for me. Okay, push down. Okay, very good. For your wrists, I want you to do this for me. And I want you to push up. Okay, and then push down. Strong, very good. For your hands, I want you to grip my hands. Okay, grip is strong, and I want you to fan out your fingers. Very good. For your legs, so try and open your legs. Okay, try and close them. Okay, down here, one more time, and then again. Very good. And then I'm going to have you go like that with your legs to touch your hips. Okay, I'm gonna push down. Okay, push up. Okay, strong. And then also for the feet. So if you could push up with your feet, so like this. And then push down. Okay, very good. So motor strength and testing is good. Now I'm going to move on to observing the patient's gait. So Michael, I'm just gonna have you stand right here. And I'm gonna watch you walk from here to the chair and back. Okay. So gait looks stable, it looks balanced. Very good. Now I want you to do a heel-toe walk like you're balancing. Okay, very good. It's fine. Okay, very good. Now we're just going to have you walk on your heels. Okay. Then I want you to walk on your tippy toes. Okay, very good. And then now I'm going to do the Romberg test. So his gait looks good, stable, balanced, everything like that. Okay, so let's move you up here. Okay. So for the Romberg test, I'm going to have the patient put his hands out like this. I'm going to stand behind the patient just in case he falls. I'm going to push down just to make sure he has balance. Close your eyes for me. And push down again. So I'm just, for the Romberg test, I'm just going to have the patient stand here. It says for 60 seconds, but right now I'm just going to do it for a couple of seconds. And balance looks great, so he's good. Okay, Romberg test is good. Very good. Now I'm going to be doing the patient's DTRs. So we have this chair here. I'm just going to have you sit right here, Mike. I don't have a reflex hammer, but I have a screwdriver. Okay. I'm going to first start with the patient's bicep reflex. So just relax your arm, okay? Okay. Just going to have the patient relax. Very good. Then I'm going to do the patient's tricep. And here, so just relax, okay? Okay, very good. Just relax. Very good. And then I'm going to move on to the brachioradial reflex. So just relax here. Okay. It's a brachioradial. Then I'm going to move down to the patellars. So if you could just relax your, I'm just gonna shake to relax him. Just gonna hit the tendon here. Ooh, okay. Sorry for, but okay. Very good. Now I'm going to move to the Achilles tendon down here. Okay. Okay, very good. And at this point, since I'm already down here, I'm just going to check for the patient's Babinski reflex. For this one, I don't want to see the toes curl out. They should curl in. Okay, sorry. There was no fanning. Okay. So, very good. Neuro test is good. And if you could just repeat those 3 words for me.
Base, couch, and table.
Perfect. Very good. So now we're going to move on to the abdominal assessment. Okay? All right. So I'm going to have... Okay. So first... Okay. I'm just going to have you lie down. Great. Okay. First I'm going to ask the patient, have you had any issues with your stomach? Any recurrent pains in your stomach area?
No pain.
No.
Nothing wrong with it.
Any problems with bowel movements that I should know about?
No problems with bowel movement.
Perfect. Okay, so I'm just going to lift up your shirt just so I can assess your stomach area a little more. Okay, and I'm just going to pull this down a tiny bit. Okay. So for the abdominal assessment, I'm going to start off just by inspecting. So I'm looking at the patient's Abdominal area, I'm looking at the contour. It looks rounded. I don't see any masses, any distended veins. I don't see any distension, no stretch marks, no scarring. Looks normal to me. Okay, after inspection, I'm gonna go ahead and move on to auscultation. Okay, so I have my stethoscope here, and with the diaphragm, I'm gonna be auscultating the 4 quadrants of the patient. I'm noting for the bowel sounds the presence in each quadrant and either if they're hypo or hyperactive or normal active. And I'll start with the right lower. Okay, very good. I'm also going to be auscultating for the bruits. So I'm turning it to the bell. I'm noting the aortic bruit. Don't hear anything. The renal. The inguinal. Okay, and excuse me, I'm just gonna do your femoral, okay? So for the bell, if I hear any bruits, it would indicate vascular occlusive crisis, but I don't hear anything, so patient is normal as of right now. Great. So now we're going to move on to percussion. Okay. So with the percussion, I'm just doing my finger and just lightly tapping the patient. I'm noting tympany and dullness, okay? So I'm starting here. There's the 4 quadrants. I'm actually gonna take off my gloves for this. Okay, so I hear tympany all around. That's good. Now I'm going to be percussing for the liver span. So for the liver, I'm percussing along the mid-clavicular line. For the inferior border, I'm starting beneath the umbilicus. And when I hear dullness, that's the beginning of the liver. Okay, so it seems like right here, that's the inferior border. And for the superior border, I'm starting at the nipple line. Okay, and there was a change of sound here. So about there for the liver. And that looks normal. I'm not noting any liver enlargement as of yet. Okay, now I'm also going to be percussing the spleen. Sorry, so I'm just going to be turning a tiny bit for me. Very good. So I'm percussing along the anterior axillary line, underneath the lowest left rib. So I'm just percussing, and it's tympanic. Can you take a deep breath for me? Okay, and it's still tympanic, so no splenomegaly. Okay, you can relax. I'm also going to be percussing your bladder, so I'm just going to move your shorts a tiny bit lower. Okay, so the bladder is usually over here, and it sounds hollow. If I were to hear any dullness in the bladder, it can sometimes mean urinary retention, so this is normal. Okay. Now I am going to be palpating. So just with my hands, I'm going to start with light palpation in the 4 quadrants. Okay. So I'm just going to push down your stomach and let me know if there's any tenderness, okay? Or any pain. Pain?
No pain.
Great.
No pain.
Okay.
No pain.
Great. I'm going to be starting with deep palpation. Okay.
No pain. No pain. No pain. No pain. No pain.
So when I'm palpating, I'm noting for rigidity, any masses that I feel, any enlarged organs that I feel, but Everything looks good. So now I'm going to be palpating for the liver. So I'm just gonna have you put your hand up here for me. Or maybe lift your hand for me. There we go. Okay, so for the liver, I'm putting my left hand underneath the patient to support the patient. And lateral to the rectus muscle, I'm just pushing gently in and up to feel the inferior border of the liver. And it's right there. So here when I'm palpating the liver, I'm noting for enlargement, any hardness, which I don't feel. Looks good. And now for the spleen, I'm gonna reach over the patient over here. That's fine, just relax. Okay, supporting that. Then with this hand, I'm palpating underneath the left rib. Take a deep breath for me. Okay, and I'm not feeling any spleen, which is good. Okay, that looks good. So now I'm going to be palpating for the aortic pulses. So I'm just gonna push down deeply on your stomach, okay? Just relax. So I'm noting for any pulsations. And I'm also noting the width of the aorta if it's enlarged. Okay, I'm also gonna palpate for the inguinal nodes, right here. Okay, and then your femoral nodes. Not feeling anything there. I'm also palpating for the diastasis recti. There's no separation that I'm noting. And that's it for the abdominal assessment. Now we're going to be moving to the arterial and venous part of the exam. So if you could just sit up for me. Sugar. Okay, so first I'm just going to be palpating for the carotid pulses. Okay, they're strong. I'm going to be testing for your brachial pulses. Okay, very good. Okay, very good. I'm going to be checking your radial pulses. Okay, I'm checking your dorsal pulses. And then I'm also going to be palpating the posterior tibial pulses, which is good. Okay, very good. And I'm going to have you lay down again for me. I'm going to be palpating for the popliteal pulses. So just keep your legs bent for me. Okay. Okay, very good. I don't feel them, but... So pulses feel strong, they're not thready or weak. That looks good. So if you could sit up for me again, Michael. I'm going to be palpating for your epitrochlear nodes. Okay, so I'm just gonna be perfect. So for here, just palpating for any nodes that I feel. I don't feel anything. Other side. Okay. Okay, very good. And I don't have my gloves, but I'm also going to be palpating for the auxiliary nodes. I'm just going to keep his shirt there. Actually, I should. In real case scenario, I would have gloves on and okay, here we go. Sorry. Ticklish. I'm just palpating for any nodes that I feel. Okay, and I don't feel any tenderness, any pain when I'm doing that?
No pain, no
Great.
tenderness.
Okay, let's do it one more time. Okay. Very good.
No
So
pain,
I
no
don't
tenderness.
feel any nodes. And I think that's it. Do you have any questions for me, Michael?
No questions.
Okay, everything looks good for me. Thank you so much.
Alrighty.
Thank you.